nerve is the purely motor nerve. It has two parts: cranial root, that is spinal visceral efferent. Spinal root, that has some controversy. Some people say it's special visceral efferent, some people say it's general somatic efferent. You don't have to get into that debate, but that's the part that we will be discussing more: the spinal root. The cranial root, it's originating from the nucleus ambiguous. It's the same one that was giving rise to the fibers of the vagus and the glossopharyngeal. So it's special visceral efferent. Spinal root, it's originating from the spinal cord anterior horns of C1, C2, C3, C4, and C5. So this nerves, what happens is that the cranial nerve simply emerges from the nucleus ambiguous and comes out. These nerves, they exit, comes to the lateral aspect of the spinal cord. They climb up between the anterior and posterior roots, moves into the cranial cavity through foramen magnum, and come and they fuse with one another. They two join each other before exiting the jugular foramen. After exiting the jugular foramen, they get separated again, and the cranial component fuses with the vagus nerve. Here, one thing you can see is that it has cranial component has everything in common with the vagus nerve. It is special visceral efferent. It is originating from nucleus ambiguous. It is joining the vagus nerve, and it is going to supply the palate, pharynx, and larynx. So for all the practical purposes, cranial root of accessory nerve, it's a part of vagus nerve. And that's, I will suggest you how you remember it. And that is why in a lot of books, including Kaplan's neuroanatomy, BRS neuroanatomy, KLM anatomy, these books, they do not acknowledge cranial part of accessory nerve as an independent nerve. They just say it's a part of vagus nerve, get it aside, and they only talk about the spinal part of accessory nerve. Spinal part of accessory nerve, let's talk about that. It is originating from anterior horns, moving between the two roots, foramen magnum, posterior cranial fossa, joining the cranial root, getting separated again. And it supplies two muscles, sternocleidomastoid and trapezius. The supply to the sternocleidomastoid does two functions. It allows you to look to the opposite side. I have contracted my right sternocleidomastoid. It is allowing me to turn my head toward the left side. Second, if both of these muscles are working together, they allow you to look like this. If you see me like that, this. Flexion at the neck, extension at the head. So that's the function that is occurring at the sternocleidomastoid. So if sternocleidomastoid is paralyzed, it will lead to inability of turning the head towards the opposite side. You cannot turn your head like this. It leads to inability of turning the head towards the opposite side. Trapezius, loss of trapezius lead to paralysis of that muscle. Trapezius was responsible for shrugging of shoulders. The shoulders will drop. In a normal situation, the paralyzed side will be dropped like this. It will be lower than the healthy side. And it is responsible for rotating the scapula for overhead abduction. So the person will have a difficulty in overhead abduction. In overhead abduction, there is another muscle involved, that is serratus anterior, that is in the upper limb, that is supplied by the long thoracic nerve. So the students ask me that if there is an issue of the overhead abduction, which we should pick, the trapezius muscle or accessory nerve or serratus anterior and long thoracic nerve. The answer that comes is that you should look for other features, like trapezius is leading to drooping of shoulder also. Serratus anterior is going winging of scapula, or the nature of injury. Trapezius or accessory nerve will be damaged inside the posterior triangle of neck during neck dissection of the lymph nodes, posterior triangle of the neck. And the long thoracic nerve will be damaged in the axilla, the medial wall of axilla, usually with the surgeries involving the breast. So that's the differences between the two. And congratulations, that leads us to the last cranial nerve, that is hypoglossal nerve.